Did you know that most people with low back pain don't actually need an MRI? I know that this is a controversial statement to make, and in today's video, we're going to explain to you why. But first, I want to make sure you're in the right place. Now, you may be having low back pain and you've already been to the doctor and you have wanted to get an MRI, but the doctor hasn't ordered one, and you want to understand why. Then today's video is for you. You may be suffering with low back pain and you're wondering if you should go to the doctor so that they can order an MRI. Then today's video is for you. However, if you have already determined that for whatever reason your low back pain requires an MRI and your position will not be changed, and the only reason for you watching this video is to find a controversial hot take to actually prove your opinion, then please let me have you scroll on by. This is a controversial video because I am going to explain things from the doctor's perspective as well as what is actually happening with your body. However, I understand that there are many people out there who don't actually want to hear the science behind it or the logic behind it, and they want to continue believing their opinion. If that's you, I just ask you to please scroll on by because this is not going to be helpful for you. I don't want to waste your time either. Now, first, let's talk about MRIs. Many people believe that an MRI and the report that comes from getting it is the gold standard for diagnosing back pain. Now that can be, but it depends on what is causing your low back pain because some things don't show up on MRI. And that's what we're going to discuss today is the things that will show up and the things that won't show up, as well as determining when it is that the next best step for you is getting that MRI. MRIs have been around since the 1980s, but weren't covered by Medicare Part B until 1985. And when they became covered by Medicare, because every insurance company follows Medicare, so whatever Medicare does, over time, every insurance company is going to do, then it became extremely popular. In fact, I don't know if you remember, but there used to be clinics that were set up outside of hospitals that would offer MRIs because at the time they were really well reimbursed. So anything that's really well reimbursed is going to get done more. The number of MRIs that were being performed exploded. Now, did all of those people actually need MRIs? Well, that's a really good question. The truth of the matter is, at the time, we didn't really know much about MRIs. I mean, we knew what they could show, but we didn't know what was actually normal. And that brings us to today's day and age. So it's now 40 years later. We've had pretty much regular access to MRI machines. And so now doctors have 40 years of reports to look back on. So now we can actually do some research on it because now we have 40 years of reports, 40 years of diagnoses, and 40 years of managing patients, particularly with chronic low back pain, to tell us, does the MRI actually give us usable information that helps to improve the patient's outcomes? Now, it's understandable if you're suffering with chronic low back pain or even a recent onset of low back pain that you want to understand exactly what's going on. And that's what people believe, is that they go get an MRI and they can actually see what's going on. And that's true to some degree, but it's not true necessarily for you and your pain, because any MRI report needs to be read with a really clear understanding of what the patient is suffering from and what their clinical signs and symptoms are. Let me explain. MRIs are really good at showing if there's a disc problem, if there's a nerve, if pressure is being put on the nerve, if pressure is being put on the spinal cord, and even if there's potentially a fracture in the vertebrae. These are the things that do show up on an MRI, and therefore doctors are able to interpret them in light of your symptoms. However, there are certain things that do not show up on an MRI, and most commonly what I see in my practice is muscle issues. So obviously, if you have a muscle tear, that's going to show up on MRI. That's not what I'm talking about. What I'm talking about is if there's an area of muscle that's particularly tight, or a muscle that in general is so tight that it's not functioning correctly and putting stress on other areas and tissues. Let me explain this with a story. I had a patient recently who came in to see me who had been to see multiple other practitioners. She had seen multiple doctors, and she was literally at the end of her rope. She had been told by the last practitioner that she saw that there was nothing to be done for her. She clearly just needed surgery, and the practitioner basically threw up her hands and said, "Nobody can help you." This is how she wound up in my office, and she was despondent. I mean, she had had this low back pain for years, and she was almost housebound at this point because it was really difficult for her to walk. It was really difficult for her to drive a car. So she was basically stuck in her house all the time, but she couldn't even do anything around the house because she had so much low back pain. Now you can imagine the frustration and the anger and the fatigue and the anxiety that went along with all of this, not knowing what was wrong, being told we've tried everything and none of it works for you, so you just need surgery. She was not in a good place when she wound up in my office. So along with coming to see me, she also went to see a doctor who recommended that she get an MRI. So we started working together, found out that she did have some lumbar spine pathology, but what was really the problem was her SI joints. See, her SI joints were out of alignment, and this was putting an abnormal stress through her lumbar spine. So yes, she did have some disc issues and some muscle dysfunction and an imbalance that was happening, but it was really stemming from her SI joint issues. Now, she went and had the MRI, and since she's over the age of 20, it had lots of great things to show on the report. Let me explain that. You see, the discs that are in between the vertebrae throughout our spine have a direct blood supply to them until about the age of 20. So this helps keep them nice and nutrition and plump and happy. But over the age of 20, gravity starts pressing down and those direct blood supply vessels go away. So at that point, we have to get nutrition through the disc through a process called imbibition. You can think of it like a sponge. So you squeeze a sponge and all the water goes out. You put it underneath the water and the water flows into the sponge. That's how discs, when you're over the age of 20 years old, get their nutrition. Now, since my patient was not moving correctly, obviously her discs were not getting the proper nutrition. So when she got the MRI, lots of things showed up. She had an anterolosthesis, she had a spondylolisthesis, she had disc degeneration, she had disc herniation. Basically, everything that could be on an MRI report was on there at one level or another. And it was literally L1 through L5 that was in dysfunction. Luckily, she had a fantastic doctor who looked at this report and said, you know, most of this is actually pretty normal. What we're finding is that a lot of these things happen as we age. Now, a sidebar conversation that we could have is that every tissue in your body is designed to heal itself as long as it's moving correctly, which means it shouldn't be considered normal with aging. But I'm going to move forward with this story for now because that's a whole different rabbit hole. So her doctor did find one particular level where there was a pretty big herniation and it looked like it could be putting pressure on the nerve. And so the doctor said, hey, let's go ahead and do an injection at that level, reduce that herniation, and then that will take pressure off the nerve and that should help your symptoms. Which, of course, my patient came in and asked me if I thought that that was a good plan. Now, I had not seen her MRI images because I did not have access to them, but I had read her MRI report. So I did understand where the doctor was coming from and what he was seeing in regards to doing that injection. However, I still did not believe that that was the primary source of her pain. I still believed that the primary source of her pain was from the SI joint. So I told her, hey, listen, I don't think this injection is going to do what the doctor thinks it's going to do, but it will be diagnostic. So if you get the injection and it doesn't relieve your symptoms, well, then the doctor's going to know that they need to inject a different area. So then you can have that conversation afterwards. You see, the doctors decide on where to do the injection based on the MRI report and also based on your subjective complaints of symptoms. So with the MRI, they have a pretty good idea, but it doesn't necessarily mean they're going to hit the nail on the head every time. With her, she did get the injection and she did not experience the relief of symptoms that she was experiencing. So when she went for her 3-week follow-up with the doctor, I recommended that she talk to him about the fact that she was not getting the relief that she was expecting and asking if he felt that an SI joint injection would be warranted at this time. You see, that's where it's really helpful to have someone on your team who, one, understands what's going on with your body, and two, is able to advocate within the healthcare system. You see, if you've been a PT for a while, you know how all of these things work and you know what the expected outcomes are, so you can help your patients actually be able to navigate through that system. Now, I am happy to say that my patient is currently scheduled to get an SI joint injection next week, and I am super excited to find out the results because I believe that along with all the work we've been doing, this is going to be the final thing that helps to eliminate her pain, which will allow us to move forward with more endurance and strengthening type exercises. She hasn't been able to tolerate those exercises to this point because of the pain and dysfunction she has in her SI joint as well as in her lumbar spine. So right now she's doing more coordination exercises and cardiovascular activity. The point of that story is that the doctor saw something on the MRI that made sense to inject. He did a subjective review to see if that made sense with her pain pattern, and all of those things lined up. However, when he injected the spot that made sense on the MRI, it still wasn't the correct spot for the pain complaints that she actually has. Now, you could say it didn't work. I mean, it didn't change her pain. However, it became part of the diagnostic process that helped her to get forward to the next step. And the important thing about this is when you've been suffering with chronic pain, you sometimes have to kind of navigate through these roads, and it can be difficult. And I understand that you get frustrated because you try this and it doesn't work, and you try this and it doesn't work. And that's where it's really helpful to have a guide along the way who can help understand why that didn't work and then what you should do next, which is why I strongly recommend that you work with a manual physical therapist. And here's the point overall, is that the MRI may not be able to show the damage that's been done to explain your pain. MRIs cannot show muscle tension or muscle dysfunction. MRIs cannot show pressure on the nerve that occurs with active motion. You see, some people will get an MRI and it doesn't look like the disc is pressing on the nerve because in the MRI you're laying down and so you're just in that supine position. However, it could be that when you get up and walk or bend over or do some other activity, that herniation moves, puts pressure on the nerve, but only in active situations. The MRI is just not going to be able to show that. The MRI cannot show tension on the nerve that may be occurring in the hip or leg. The MRI does not show postural malalignment or a bony alignment that's happening in the pelvis. The MRI may be able to show the disc dysfunction that is a result of that bony malalignment. However, in the end, even if you get an injection, even if you get surgery, it's not going to fix the bony alignment issue in the pelvis, which means chances are good that your symptoms are going to come back. Yes, it might take a couple years, but is it really worth having surgery just for a couple years of relief? The key insight here is that most cases of chronic low back pain can be resolved without an MRI. And if your doctor is refusing to get an MRI, chances are good that this is what they're thinking, that what you are suffering from will not show up on an MRI. And realize that that can be extraordinarily frustrating. I have had patients who had low back pain who did go get an MRI. And when they went to have the results read, the doctor said, I don't really see anything here that's great. You know, you don't really need an injection. You don't need surgery. You just have chronic low back pain. And they're frustrated because the MRI report does show stuff. It's just that after 40 years of studying MRI reports, we've kind of come to realize that patients who have pain, as well as people who don't have chronic low back pain, have stuff in their low back that shows up on MRI. But if people can be walking around without pain in their low back and still have things that show up on MRI, well, what does that mean for the rest of us who do have low back pain? What it means is that the source of your low back pain may be something that's not going to show up on MRI. Is there ever a case when I do recommend getting an MRI immediately? And yes, There are several. I highly recommend if you lose bowel and bladder control, that's called cauda equina syndrome, where you cannot control your bowels and bladder, you need to see a doctor right away, and most likely they are going to order an MRI right away because we do need to see exactly what's going on with those nerves. If you have a sudden loss of strength in both legs at the same time, and I mean loss of strength, like I cannot walk because I have no control of my legs, chances are good. Then you need to get in to see a doctor, and chances are good that they are going to order an MRI because, again, that's a very acute situation and it needs to be dealt with immediately. The third reason why I do recommend patients with low back pain seek help immediately from a medical professional that may lead to an MRI is if you have sudden, sharp night pain. Now, this is not low back pain that occurs when you're trying to turn over from side to side. Most likely that's a mechanical issue, and that's kind of normal in the orthopedic world that I work in. I am talking about you are laying in one position and you have this sharp stabbing pain that wakes you up in the middle of the night. At that point, I recommend that you get in to see a doctor just as quickly as safely possible, and chances are good that they are going to order some imaging to see exactly what's going on with your back. All right. I hope now that if you've been wondering why your doctor hasn't ordered an MRI, or you've been wondering if you need an MRI, that has answered your question. I hope that you understand what can show up on an MRI and what doesn't show up on an MRI, so that if you do get results and the doctor says, they don't really look that significant, at least now you can understand why and what they're saying. And please understand, this is different than what we knew 20 years ago, because 20 years ago, MRIs were still new and there hadn't been any research done to look at this whole thing as a collective process. This is what we get with experience, is we get more knowledge on who is appropriate for MRI and who doesn't need to have an MRI just yet.